Thank you for sharing the 15th Congress of the Argentinian Society of Cardiology. In this opportunity here, we are in very special visit from Dr. James St. Louis from Children's Hospital, Georgia, USA, is visiting us concerning the World Database for Pediatric and Congenital Heart Surgery. And Jim, it's a pleasure to have you here, and we'd like you to ask you some questions regarding the World Database. Our first question is, what are the key challenges in creating a global platform for congenital heart disease treatment, especially in regions with limited healthcare resources, and how can they be addressed?
Thank you, and thank you for the invitation. It's truly an honor to be here today. Getting right down to it, one of the biggest challenges is that although 75% of the world's population that have a congenital heart defect don't get adequate therapy, it's small compared to other major issues with pediatrics, such as malaria, AIDS, across the globe, especially in underdeveloped countries such as Africa and some parts of South America. So the biggest challenge is getting the acknowledgement for resources to help treat these children, and they do need their advocates to be able to do it. These resources are few and far between. We spend a lot of money on different areas within healthcare and other areas in the globe that is unnecessary, in my opinion. But getting people to understand the gravity of the situation of children living with congenital heart disease that don't get adequate therapy in this day and age is really an abomination.
Okay, great. And what do you think of how do national databases, such as the one established in South Korea and in other places as well, have contributed to improve outcomes in congenital heart surgery? And what are the clinical factors in ensuring their success in other countries?
Yeah, great question. So advocacy is important, having a momentum with people wanting to feel dedicated to doing this, but it's all is trivial compared to the need for data. Without having concrete information to what's going on with these children, both in developed and undeveloped countries, it's nearly impossible to get people to acknowledge the fact that's going on. So I think the database, the global platform that we've been working on for the last decade, provides for the first time a global registry of this kind of data throughout the globe. And having countries contribute, such as South Korea, their information, it sets standards of what these children should be, how they should be living, and the outcomes they should be having.
Okay, great. We have another question: is what will be the role does international collaboration, such as through the World Society for Pediatric and Congenital Heart Surgery, play in closing the gap in access to congenital heart disease care? And how can these efforts be scaled to reach more underserved populations?
Yeah, another great question. I mean, our numbers, comparatively speaking to other pediatric ailments, as I said, are smaller. Having a global platform, bringing all these people together, all these numbers together, generates a force that we can't do on our own, either within individual countries, individual continents. And having this kind of resource, this ability to go to a platform that says, we have these many patients across the globe, that's where our power comes from. And that's what I believe why this is so important in treating patients, especially in the underdeveloped sectors of the globe.
Okay, great. And how can we use this data from national heart surgery databases be utilized to drive research and to improve clinical practice?
Yeah, I think the biggest problem I faced early on with the database was that individual centers on their own don't have the ability, resources, to be able to contribute in a meaningful way to the overall database. But on a national level, getting countries such as Argentina to put resources into a national database, a national registry, whatever form they want to do it, and link that to a global platform, then we use that information to come back to the individual national advocacy groups and governmental healthcare systems, healthcare registries, to get the resources needed. So I think the best thing we need to do is formulate the ground level within the nation, advocates like yourself, Ignacio, here in Argentina, who've been pushing a national database for a long time, to help form that camaraderie within the country. First of all, it can be done in your own language, which is a big deal. The Wi-Fi bandwidth issues can be solved by that because we can directly link a national database with the world platform in a much simpler way than individual institutions. And individual institutions can go to their administration and say, I am contributing to my national effort, not an international effort, because honestly, healthcare, professionals that are looking at the bottom line don't really care about what's going on in India or in South America or Africa. They want to know what's going on in their own country.
Yeah, correct. Thanks. And what are the strategies that we can implement to ensure that healthcare providers in our countries are trying to use the global platform effectively? And how can these challenges be mitigated?
Well, I think the biggest thing is getting the resources within the individual institutions with either provincial governmental support to do that. Because once that's done, and the biggest problem we have is getting individual centers to input the data. And once the data is imported, the rest of it on a global scale is pretty easy. The system's been set up. You contribute to the mechanism by which data is collected, how it's brought into a single platform, and then fed back to the institutions to their use to give to their administrators. So I think it's getting the resources locally, and once that happens, which is not a lot of resources, honestly. You know this, you do this, you contribute to the database. You do 3 cases a day, and you're tired to go put in the cases into the computer. But if there's resources to help you with that, that's the way of getting this up and going, coming back to the benefit that it should be providing.
Okay, that's great. The last question I have to you, Jim, is how do you envision the global platform influencing policy changes or resource allocation in countries with high rates of untreated congenital heart disease? Yeah,
my dream, our dream, Ignacio, and the world society's dream is to have enough individuals, enough countries involved in this. And I'm telling you, it's coming. Philippines, Argentina, Brazil, Malaysia, South Korea, all these, having that all part of this effort, and then going to organizations such as the World Health Organization, going to the Bill Gates Foundation, generating millions of dollars in endowment to help support this and then feed that money back into the care of these children, not into the database. People don't pay for databases, but people do care for care of children. And if we can have the data and we can show them the issues that are occurring and get the resources to be able to do that, then we could provide resources such as your institution to help treat children that aren't getting the treatment they need. The resources just aren't there.
Okay, great, Jim. Thank you very much for having you here. It's an honor to have you as a visitor for this meeting, and hope to see you again soon.
Thank you very much.